Currently, we have 109 reported cases and 1 fatality regarding H1N1 in the United States, with 1 case in Arizona, 1 in Indiana, 1 in Michigan, 1 in Nevada, 1 in Ohio, 2 in Kansas, 2 in Massachusetts, 10 in South Carolina, 14 in California, 50 in New York, and 26 cases in Texas and 1 death. You can keep up to date on the spread of H1N1 by visiting the CDC website, www.cdc.gov/swine flu. When people hear that number, 109 confirmed cases in the United States, what does that mean?
Well, what that means is that we have 109 individuals who had flu-like symptoms and did what they should. They went and saw their doctor or called their doctor, got tested, and they are confirmed as having the H1N1 virus. We have those individuals in 11 different states. And as we've all been saying, as we continue to look for cases, we expect that we're going to find them in more and more states. We're working with state and local health departments. They're investigating cases in many more states than have confirmed cases. And we expect, as we move forward, to see a wider spectrum of disease with some more severe cases as well.
All right, let's talk about what does this change mean from the World Health Organization that we're now at 5? What does it mean to us in the United States and to us as individuals? And when the World Health Organization says they have 148 cases worldwide, what database are they using? That seems out of phase with what we know right now.
Right. I was pleased to see that the WHO had made this move. In the United States, it does not have an impact in that we have cases here within our borders, and we're taking aggressive action to try and minimize the impact on people's health. What it means for the world community, though, is that countries around the world that haven't started their efforts around preparing for a new flu strain, it's time for them to wake up, pull out their plans, and think about what they would do if they had cases appearing in their own borders. The number 5 means that, according to the World Health Organization, a pandemic is imminent. And that means that this strain is spreading and it is causing disease in more and more places. That's basically what that number means.
So I know your message has been that the government is responding aggressively regardless of what the designation is, correct?
That's right. Whenever we see a new infection, whether it's flu or another one, we take aggressive steps to try and understand what's going on and implement rational, smart control measures. And those measures change as we learn more. This is a situation like others in that we take what we know, we implement measures, and we adjust as we get more information.
Secretary Napolitano, let me ask you something that I've heard from people. I'm sure you've heard this. Why isn't the United States closing its borders?
Well, a couple of reasons. One is the epidemiologists, the CDC, the WHO, all have said there's no utility to closing the border. The president last night likened it to closing the barn door after the horse already is out of the barn. And therefore, we're doing the things that make sense from a public health standpoint to protect the safety of the American people. So the real focus needs to be now on what do we do to reduce the spread of the disease within our borders. But closing the borders in and of themselves won't have that kind of an impact.